Okay, I'm going to go ahead and get our webinar started this evening. Thanks everyone for attending. Michael has been the lead person so far on putting everything together into the database. So for the most part, he is going to facilitate, and I'm going to make him the presenter and let him take over and introduce our guest from Erie County.
There we are.
Great. Thank you very much, Susan. Our first presenter or speaker today is Sharon Schaefer. She is with the Erie County Health Department, and I will just go ahead and turn this over to her.
Okay. I see John is on. John, are you on now?
I am here, yes.
Do you want to go first? Did you say you have another meeting or something else?
No, I'm good. Nope, I'm sitting at home in my chair.
Okay. Okay. I wanted to make sure that you didn't have something else going, and if you wanted to go first or whatnot. So okay, that's
no. I'm doing this through my cell phone because I can't get my Macintosh to log on to go to meetings. So
okay.
If you don't mind going, I'll try to figure that out in the background.
Nope, that's fine.
While you're done.
That's fine. That's great. Well, hello everyone. My name is Sharon Schaefer. I'm the Director of Community Health here at the Erie County Health Department, and the 211 program has been in my division since I started in the division in 2008, and actually we started with 211 back in 2007. So I want to give you a little picture between John and I, give you a picture of Erie County so that as you're answering calls on our behalf and working with our community members, you have a little bit of a better understanding of Erie County and what we're about. So Michael put this map up there, and actually the map is the geographic distribution of Erie County, and it's got those jagged lines out around Kelly's Island just to prove or to show Kelly's Island is part of Erie County. The actual edge of the Erie County runs along the area that's in Sandusky and Huron and Vermilion, and that's the actual shape of our county. And then Kelly's Island is out there in the water. It is part of our county as well. A few things to make note of. We are Erie County, Ohio. Sometimes if you Google Erie County, you get Erie County, Pennsylvania, but we are Erie County, Ohio, and Sandusky is our county seat and the largest city within Erie County. To our west is Sandusky County. So Sandusky is not in Sandusky County. That's named after the Sandusky River. The city of Huron is also in Erie County, and you can see that on the map, but to the south of Erie County is Huron County. So the moral of that story is Sandusky is not in Sandusky County and Huron is not in Huron County. Those are both two cities within Erie County. As you can see on the map, we do have I'll point out that we do have three areas that are considered cities in Erie County. And John will go through and talk about, some of the things in the location and the demographics on the location of that and pronunciation of names and all of those things. Cedar Point brings thousands of visitors in addition to a few thousand young employees, which include many international students. Cedar Point is out there kind of on the tip, and I know Michael pointed that out for the last group, that is Cedar Point right there. And tourism is our main business. It's our main economy in Erie County right now. We used to be a large manufacturing business county. We at one time had a very large and active Ford plant, what we called a Ford plant and a GM plant, and both of those manufacturing facilities, they still manufacture automobile parts, but they are not directly related to Ford or GM, and so those unions have moved on. We've had many residents that are either commuting to other jobs or to other some drive to the Cleveland area to the factories that are still union there. So we've lost a lot of industry in Erie County, and John can speak to that a little more detailed when he gets on. Sandusky City, this is the Sandusky City School District. All of those students receive free lunch. They have such a high percentage of free and reduced lunch eligible families that they provide free lunch, the free school lunch to all the students, both breakfast and lunch in that school district. So that demographic shows that that's the highest population of low to moderate income families in Erie County. A couple things with pronunciation, and I think John dropped off, so he may end up repeating this, but over in...
I'm here.
Oh,
I'm
okay.
here.
I saw you drop off. You must have got signed in on your other other system.
I found a way.
Okay. Okay, good. If you look to the left of Erie County, the left side of Erie County, we have Castalia, which is one of our villages. Bayview is also a village, but I wanted to point out how you pronounce Castalia. Groton Township is a township below. We have Oxford Township and Milan Township, and all three of those are pretty, you go over to Florence Township. That whole southern part of Erie County is very agricultural. There are a lot of family farms. When we talk about family farms, we talk about maybe 2,000 or 3,000 acres to some of the larger farms that are farmed and that support those families. You see Milan. Milan is both a township and there's the village of Milan, and as I've mentioned, we pronounce that Milan, not Milan. So Milan is the proper pronunciation. We have Berlin Township and then Berlin Heights, which is also a village in Berlin Township. So that's kind of the more rural parts of our community. And we have good health and social services within Erie County. There are a few areas that we are working to improve. Right now, we currently have no drug or alcohol inpatient treatment center. So anyone that needs to be referred to inpatient treatment or detox does need to go to the Toledo or the Cleveland area. Our local hospital frequently makes referrals to the Toledo area if someone comes to the hospital in an emergent situation, but they do not keep adult or youth patients that are in the process of with detox or alcohol inpatient treatment. We do have an inpatient treatment facility for mental health. So we do have an inpatient mental health facility at Firelands Regional Medical Center, but not for alcohol or drug rehabilitation. We have started a brand new sober living community in Vermilion, and that will target women and women with children. That's called Genesis on the Lake. That's still in process. It will be residential actually this month, and probably before we go live on October 1st, they will have that filled already. So any referrals for the sober living community for families, and right now we're targeting women and women with children, those will come through Job and Family Services of Erie County. They're serving as the clearinghouse and as the point of identifying those families that will start out in that sober living community. We have one hospital within the county, and that's Firelands Regional Medical Center. Ironically, or also that is our largest employer currently within Erie County of full-time or of continued employment. Cedar Point and Kalahari Resorts both have fairly high numbers of employees as well, but many of them are seasonal or part-time employment as well. Back to the hospital issue, there are several other hospitals in the surrounding counties. Many Erie County residents choose to go to Fisher-Titus Medical Center in Norwalk, which is here in county. The Bellevue Hospital is over in the corner of Groton Township, and Bellevue, the city, is actually in 4 counties. And some people do use the Bellevue Hospital for their care as well. We also have Magruder Hospital just over the Bay Bridge into Ottawa County. So there is a fair amount of movement around in hospitals around the area. We have 2 federally qualified health centers in Erie County. The Erie County Community Health Center is here at the Erie County Health Department. We provide both medical and dental services. Dental services had been always been a gap for those either with no insurance or Medicaid. Prior to the last couple of years, there was very limited to the number of dentists that were accepting Medicaid or self-pay patients in Erie County. So we've had the dental services for 2 years, and we've been conducting medical primary care in the federally qualified health center since 2011. We obtained our full lookalike status just earlier this year. There's another federally qualified health center in Erie County called Family Health Services. In Sandusky, they are associated with Firelands Regional Medical Center, and currently they do not have dental. So we are the primary safety net dental clinic in Erie County. In addition to the Community Health Center, which is primary care, and we have a full-time physician whose background is in emergency services and primary care, we have women's health services and prenatal services, and we have a family and nurse practitioner, a women's health nurse practitioner full-time that does those services. We also do have another mid-level nurse practitioner that assists with the primary care as well. We do STD visits on Monday. Our infectious disease doctor in the community does STD clinic here at the health department, but again, if someone needs evaluated for an STD, they can also schedule through the primary care to be assessed and evaluated. We have urgent care in Erie County as well. And a lot of tourists go to the urgent care center when they may be in town and need some urgent kind of services, but not necessarily emergency services. We also do provide immunizations at the health department. Full-time, Monday through Friday, we have immunizations available. And our main Women, Infant, Children WIC program is housed at the Erie County Health Department in Sandusky. We do have a satellite WIC clinic in Vermilion. We meet that is open on Wednesdays. And we also can accept some residents from Lorain County if for transportation and access it's easier for them to get to the Vermilion WIC clinic. So if they're living in the far western part of Lorain County, we can accept them into the Erie County WIC services. State WIC is now more flexible with allowing WIC participants to not strictly be within the county borders, but within that center where it's easy to access. The city of Vermilion is part in Erie County and part Huron County, part Lorain County. So for purposes of public health, all of the city of Vermilion and the city limits is under the jurisdiction of the Erie County Health Department, which means our sanitarians go out and do food service inspections. If someone has a reportable disease, we follow up on the investigation with that. But our community health center services are available to anyone. There are no county boundaries around that. We will accept patients from any jurisdiction. You don't have to be an Erie County resident to obtain services through the community health center primary care or through the dental program. Was there a question? Nope. Okay. We have a main agency that assists our seniors, and that's called Serving Our Seniors. They kind of serve as a mini 211 for seniors, meaning many seniors look to call them for issues such as handyman services, assistance with medications, and some things that you may be familiar with hearing as 211. And so we've reinforced with them, we're certainly not taking over their role in the community. We're just guiding through having them enrolled as a provider in 211. We're helping guide the seniors that don't know to call them to find out about the services that they provide. So they are funded through a levy in Erie County that's been in place 12, 15 years. John may correct me on that. For quite some time to provide the services that they do. Like I said, they have a handyman available for some minor things, repairs such as if somebody needs handrail on a stair or some minor modifications to a bathroom to accommodate a raised toilet seat or a grab bar, they do that as well. So we have quite a few small food pantries and community meal services that vary from daily to weekly, and some only once a month or at holiday time. We have a number of agencies that offer various services but are often run out of resources within the month, and so they may be in the database and then they may all of a sudden not be in the database if their resources have been exhausted. And this question came up in the other two, so I'll just mention it right away. Homeless services are coordinated through our VOA, Volunteers of America, and Crossroads. And I heard Mike mention that they are already in your database because they do provide those services for Huron County as well. And since you have
they provide Huron County, and actually they provide a number of services throughout the state. So we have them there already, and specifically the site in Sandusky has been in the database because they additionally serve Huron County. So some of us may already be familiar with that.
Okay.
I'm sorry, Sharon, go ahead.
No, that's fine. That's fine. And I do know that they receive some community development block grant funding, so that some of their services may be only eligible to people with a specific address. They may some of the rental assistance and some of that may need to only go to those that live within the city of Sandusky. So when you find that in the database, it may be address specific, or you know, that they can help out with the services. And I just have a couple other things on 211, and then I'll pass it on to John to give you a better picture of the community as a whole. Right now, we currently have about 140 agencies listed in our Erie County 211. We average about 120 calls per month, but that varies. And we've had some economic setbacks here in Erie County that those calls we expect may go up with both the ending of Cedar Point and more people that had been employed now may not be employed the number of hours they had been, and also one of our factories is expected to experience some layoffs as well. But that's kind of what our average. About 85% of our calls come in from the residents within the city of Sandusky, so we're not surprised that the city of Sandusky, or that the Sandusky zip code of 44870 is going to be a higher percentage of the calls. Our top requests for calls historically have been electric, gas, and rent payment assistance. They're our top requests, and they're also the first service that runs out. You know, many agencies, we can't fund everybody that needs that, and agencies such as CAC or Community Action Commission, they may have limited funds to assess. They do have funds for emergency home repairs, which you'll see once our database gets finalized, but the biggest issues are rent, gas, and electric payment, and deposit assistance, and those are the ones that run out kind of the first as well. So unless you have any questions about something I mentioned already, I'll let John go on and give you the rest of the picture of our community, and then we can talk and answer more questions. Oh, I forgot one thing. Transportation for Erie County, we do have a limited bus transit service, and our buses are not going to be anything like the buses you're used to in Cleveland or the surrounding areas. Our system is called SPARC, S-P-A-R-C. So if people talk about the SPARC route, there are several set SPARC routes that have expanded, thankfully. For a period of time, the health department was not on a SPARC route, so that was really limited. Our families had to use taxi services, or they could schedule a SPARC drop-off, but they had to schedule that a day or two in advance to make sure that they could make it to appointment. The health department, the community health center, health department, and dental clinic are on a SPARC route now. And if families let us know that they'll be coming to an appointment by SPARC, we will schedule their appointment so that we know that the bus comes past us at 11:25, and so we try to schedule appointments around that so that, you know, they're not missing their appointment or late, and that they can get back onto the route. So that is kind of our transportation. Serving our seniors provides some transportation by appointment for the seniors that need transportation. They will come to your university and Cleveland Clinic for appointments as well, but again, those need to be scheduled in advance. The Firelands Regional Medical Center also provides transport, and some of our community churches have some transport services for special situations as well, but otherwise, transportation can be an issue. So I'll pass it on to you, John, unless there's something else pressing.
Nope.
Okay.
Anybody have anything for Sharon?
I
Great.
guess not. I just want to mention that John is the Executive Director of the United Way of Erie County. We're very glad to have him. And John, feel free to go ahead.
Great. Thanks, Michael. I have only been in this post for 3 weeks. I will be finishing up my 3rd week tomorrow. I do come from a nonprofit background in economic and community development, where I spent the last 10 years running an organization that was geared toward revitalization of the Central Business District, job creation, and business development. So I have a decent idea of the makeup of the community, some of the challenges that we face, and I'll give you some information that might help you when you're talking to some of the folks here. Again, Sandusky is the largest community in Erie County of the 3 cities. It is bordered by townships all around us, and as was stated earlier, Perkins Township, directly to our south, does share our zip code. So sometimes things can be a little skewed and a little off when you're looking at demographics and you're using a zip code to take a peek at that. But to give you some background on the area, Erie County post-World War II was predominantly manufacturing, both the auto industry, very, very heavy in the paper industry. We had not only industry that we still have today that manufactures equipment for the paper making process, but then we also had several plants that were in the paper, wax paper, and or corrugated cardboard industries worldwide here in Sandusky, and those are all gone except for the manufacturing plant that makes the equipment. Again, the auto plants, at one time we had General Motors, we had Ford, and we had Chrysler. Chrysler has since left completely. Ford has now become an independent, non-union shop, and the General Motors plant is a ball bearing plant, and they have just received notification that their biggest contracts will be terminating, and they'll be losing probably a couple hundred employees, or up to a couple hundred employees. So that's going to be a big shock to our system. We currently have about an 8.5% unemployment rate in the county. The county's population is just over 77,000. The city's population is about 25,800. And if you want to look at some demographics based on race, the county residents are predominantly 87% Caucasian, about 10% African American, 3% Hispanic or Latino, about a 1% Asian or other. Sandusky is a little more diverse than that. Sandusky has about a 70% Caucasian, but then jumps to a 22% African American and a 5% Latino Hispanic, and we don't have data on Asian or other with that. The county has about an 88% high school graduation rate. The city has about an 83% high school graduation rate. The big numbers that we see that are a little troubling are countywide. We only have about a 19% college education, and the city only has about a 13% adult bachelor degree or more. The county and the city tend to be a larger percentage female than male. We have about a 51% in the county and about 52.5% in the city. And county median income is $46,900, with the city much lower than that at $34,000. We do have a poverty rate. Persons below the poverty level are about 14.5% in the county, and increased to about 23% in Sandusky. So you can see Sandusky does carry the bulk of the low to moderate income folks. Our school district is the largest in the county, and about 43% are Caucasian and about 36.5% are African American. And as I think was stated earlier, 100% of our kids in our school system in Sandusky are on free lunch program. We have graduation rates a little lower than we would like. The graduation rates for all students is about 85% in the county, but falls to only about 70% in the city. So we're really hoping to change that through some of the programs that we do. Looking at some of the jobs here, as I stated, we were predominantly manufacturing, light manufacturing, and industry. That has since shifted to more tourism and hospitality based. Cedar Point and the 3 water parks that we have here, one being North America's largest indoor water park, they employ the bulk of the summer help and become the largest employer group in the county. However, there's a large majority of those folks that come in from out of town, if even out of the country. We have a situation here where the locals don't really fill the hospitality and tourism jobs. Those are being filled by folks, again, from Germany, Spain, Latvia, Russia, a lot of Eastern Bloc companies, a lot of European countries, excuse me. And one statistic is of about the 6,000 folks that come into Sandusky in the summer to work, about half of those require group housing. So we have a lot of folks that are coming in from other areas besides Erie County and using Erie County's services. So we need to make sure when we're asking people, there might actually be someone that may have lost their job that came in from another area but aren't from here. So, excuse me. Okay, sorry, another call came in. So we're transitioning from that workforce of industry. There were a lot of people that were used to having a lot of high-paying jobs, also had a lot of overtime. Unfortunately, a lot of those folks lived their lifestyle based on overtime, and when they lost the overtime and then subsequently lost their jobs, fell into a lot of homes were repossessed, or foreclosed on, vehicles were repossessed, and now they're using some of our services that Sharon talked about earlier. So that's pretty much the breakup. I will mention one thing. Sandusky proper is about 70% rental. Of that 70% of rental properties, there's about 12% of those that are currently vacant. So we have an excess of rental properties. The majority of the property owners are out-of-town landlords. They're Section 8 apartments that are funded through our Metropolitan Housing Authority, and unfortunately, they haven't been kept in a condition that they should be. City is trying to address that with some zoning remapping and some classifications from houses that were originally set up for single family and over the years have been adapted to multiple family dwellings and are zoned for it. So that's pretty much the basic layout of Sandusky. Does anybody have any questions on demographics or the county or the city as a whole?
I do. Basically, what's the breakdown of age? Do you have any information on that? I know it's kind of seems transient in a way with the people that come in.
Go ahead, Sharon.
No, I was just looking. I think for total of Erie County population, 22%, the data I have in front of me is 22% are under 18, so about a quarter of our population is under 18. Just like many other, just like many other communities, we have an increasing aging population. You know, the whole country, with baby boomers aging, the whole country is getting older, and our statistics show that Erie County will be on track or a little more accelerated with that aging population rate as well.
I just pulled up some quick statistics. I have that the median age is 14, or I'm sorry, not 14. The median age is 40, and
Okay.
that about 15.5% of the population of the county are 65 years of age or older.
Yeah, that doesn't surprise me.
Yeah, it's a good percentage.
Yeah. And another thing I'd like to add too is just kind of John and I have been bouncing back on this conversation. We do have 2 senior, what we call towers.
That's right.
They have 8 to 10 levels there. Those are managed by United Church Homes, which is a national organization, I believe, or at least a Midwestern group that manage those. And so we have 2 of those settings, and they are both going to non-smoking as of next June. So many of those residents are working, and the facilities are very good with helping provide assistance to those that need to quit smoking, and they're working with that, but that's just kind of an FYI. We also have a 3rd tower that's about 8 to 10 stories high, and that is also Metro housing. So people need to qualify for Section 8 to be into that housing. We have a lot of residents in there that are on Social Security, may have disabilities and have comorbidities that they live in that community. So if you hear someone say they live in the towers, they could either be seniors that live in one of the 2 senior towers, or they live in the Section 8 housing. We also, and as John pointed out earlier, we have a new large, I don't even know how big the Rieger lofts are, John. How many units there are in there?
34.
Oh, okay. Go ahead and describe that. You know that much better than I do from your roles in that.
Sure. There was an old historic hotel in the downtown that was purchased by Buckeye Community Hope Foundation through Columbus. And using low-income housing tax credits, they converted that property into 34 senior apartments. They are income, that you have to income qualified to be in there, but they are not assisted. So it's some seniors and some lower income folks, but it is a 5-story building. And they're all brand new apartments. But so if you hear someone discussing in a conversation that they live in the Rieger Place or the old Rieger Hotel, that is the facility downtown. And again, it is not assisted living. It's just a large percentage of low mod to qualify for the low-income housing tax credits through HUD.
Okay, so you had said HUD, which reminded me. Which in the past we have had funding in Erie County to do lead abatement, primarily in the city of Sandusky. There was some funding in the outer communities prior to that for lead abatement. Berlin Heights, Milan have a lot of historic homes that have had lead paint and been updated, because a lot of them, the charm in those communities is the older homes. We had that abatement for about 5 years, and that also paid for an expanse of lead testing in children under 5. The health department continues to provide lead testing for children under 5 as being a partner with the Ohio Department of Health and the lead poisoning prevention program. So if you have someone that is looking for lead testing for their children, they can call the Erie County Health Department and schedule with us to have that lead testing done, which leads to me into the reminder of we have outreach clinics in each of our political subdivisions. So we are in Margaretta, Groton, Perkins, Oxford, Huron, Milan, Berlin, Vermilion, and Florence townships at the townships halls. The Huron Township also serves the Huron, the city of Huron residents, and we do Vermilion on the Lake, which technically is in Lorain County, but to help to service the Vermilion city residents that would need that services. Margaretta Outreach Clinic does Castelia, Bayview, and Margaretta Township as well. And the outreach clinics are anywhere from 2 to 3 hours depending on the volume at the clinic. Some of our outreach clinics are more popular than others, are more populated, and there's a nurse from the health department community health center that can provide immunizations, both adult and children. They can do blood pressures, they can do some blood draws, individual health assessments, answer questions as well, and those are by appointment only. We need to know what kind of supplies to take with us. We don't keep supplies stocked at all of those clinics or immunizations. So anyone that would like to receive services through the outreach clinics can call the Health Department Community Health Center and find out if the service they're looking for could be provided at an outreach clinic and schedule an appointment for that. That cycle goes through every 2 weeks, so we're out in the townships every couple weeks on a set schedule. We also do go to Kelly's Island and provide those same services on Kelly's Island. We even have nurse that flies over on the airplane when the lake is frozen and can't take the boat. So we continue to do those services, and those all can be scheduled through the health department.
You know, Michael, I forgot in the previous two conversations we had, so these folks are going to get some new information. We forgot to talk about the services that the city of Sandusky offers. And I apologize for not even bringing that up because it was in my wheelhouse for 10 years and I didn't even think of it. But they do have an emergency home repair program that qualifies, that is income qualified depending on your household size. And that information can be gotten on the City of Sandusky's website under the Department of Development.
And we do have CAC and those that provide those services through CDBG, John, do need to be enrolled in 211, and so we should be able to catch them from our current 211 base. That's the 211 system is what we use to help promote the community development block grant activities within the city of Sandusky so that it can kind of serve as that clearinghouse as well.
Yep. So I just forgot about that.
Yes.
They also have down payment assist too for folks that want to transition into a single-family home.
That is no problem. We will make sure that it's in the database.
Okay.
I have a question about the high schools. We talked about Sandusky. How many other high schools are in Erie?
There's Vermilion High School, Huron High School, Perkins High School, Firelands, which is the one in the Berlin area, and then you have
Edison. Edison. In Berlin, Milan. That's okay.
Yeah, Berlin, Milan District, and then you have Margaretta. And then there is a private Catholic school called St. Mary's.
Okay. So some of the townships share a high school.
Yeah. Groton Township down in that bottom left-hand corner, some of the residents there are actually in the Bellevue City School Districts, and some of the residents there are in the Margaretta School District. Oxford has some of their residents are in the Edison School District, which covers Berlin, Milan, and part of Oxford. And then part of Oxford Township is in the Perkins School District. So we don't have nicely defined lines based on our political subdivisions do not match our school district subdivisions as well. So there is some confusion with that. Florence does, some of the Florence residents may be in Edison School District, some of them are in the Vermilion School District, and some of them would go over into either Wakeman or Fireland School District in Lorain County. So that's kind of chopped up in that area.
Right, and we have some people that have Sandusky zip codes that are in Perkins, like in Perkins Township, but might go to Huron schools because they're right on the border of Huron Township. So it's very, very strange.
Is it possible that the food pantries may follow the guidelines of school districts for us?
You mean as far as income guidelines? Or that
no,
our food pantries pretty much in Erie County serve all of Erie County. And we had that verified. I think Michael looked that up for Care and Share. I know that our Care and Share food pantry is in partnership with the Second Harvest Food Bank, so we follow the protocols along with that. But Care and Share Pantry would serve anyone in Erie County. Again, Care and Share Pantry is located in Sandusky, so it could be transportation. We do have some small churches that may have food pantries that we have encouraged to join 211, assuring them that we can give we would give out their information based on the demographic that they choose. So if you only can live in Huron and receive that, we're not going to give that information out to everybody in Erie County and they'll get flooded. So we've worked with them, and hopefully we can continue to keep adding some of those smaller pantries and keeping the ones that have trusted us so far to continue to be enrolled in 211.
And then I had another question about the Area Agency on Aging.
Yes.
And how they might weigh in.
Our area agency on aging is actually the Toledo office. They serve Erie County. There's not an aging office in Erie County. The two primary offices that serve our senior population are serving our seniors that I had mentioned earlier and the senior center. So the Meals on Wheels is through the senior center. They manage the Meals on Wheels program. They have lunch meals provided Monday through Friday as well, along with several other programs that are offered through the Senior Center. Serving Our Seniors has an office in Sandusky, but they do not provide direct services in that office. So if they provide informational sessions or anything like that, those are going to be out in the community at a setting. They don't provide services there. They don't provide meals there, but they do a lot of coordination. Serving Our Senior does a lot of coordination with the drug program because we have a drug repository where people may be able to get prescription medications at a much reduced cost for the seniors. And also they do see people, I shouldn't say they don't, but they may do one-on-one appointments to help people understand Medicare and all the other Part Bs, Part A and B that go along with Medicare. They serve as the major agency that helps seniors get enrolled and understand Medicare. They also have the program that has the handyman, and that's income eligible to assist with some minor repairs or some safety modifications in the home. So we technically are in the Area Office on Aging. The technical services are provided through the Toledo office, but we don't have an office here in town that provides direct services with our seniors. Those are both managed through the other two senior agencies.
Okay, thanks. Any other questions from anyone?
You know, I don't realize how much I know about our community until you asked me to list it all off on a list, and then I keep thinking,
yeah, it is amazing,
wow.
Isn't it?
Yeah, I keep thinking, wow, I guess I didn't really, okay, yeah, I guess I know that, and so it's kind of funny. Until you start listing it off, you don't realize it.
The only thing I'm seeing in my notes that may have been mentioned in one of the previous is it looks like it's a recovery Genesis by the Lake project.
Yes, yes. I thought I mentioned that earlier, but it could have been in one of the programs. Yeah, the Genesis by the Lake is the women and women with children sober living community that's being established. It may be up and running by the end of September, and it might be as we transition into you taking calls for us on October 1st. All the referrals for that and all of the screening for entrance into that will be going through Job and Family Services, is my understanding, Erie County Job and Family Services.
Oh, when it comes to Job and Family Services also, does PRC ever play a role in those utility bills and rent payments?
Most of it, the CAC, I I don't believe the funding that Community Development Block Grant gets through the City of Sandusky, they funnel their utility and rent payments through the volunteers, the VOA Crossroads. So if there's a referral for that, or if that's where the City of Sandusky, that's managed through the VOA. CAC does, in Erie County, CAC does do emergency home repairs, and they accept City of Sandusky CDBG money for the emergency home repairs. And so when you look for emergency home repairs, the CAC for Erie County and the contact would be Tim Brown, should be in the database, and if not, we'll work to make sure that that's updated. We also do some contracting is done through WSOS, which is something you're not familiar. That is Wood, Sandusky, Ottawa, and Seneca counties, and they are similar to a CAC agency, but they may be contracted to do some screening and disbursement of funds as well. They have kind of been in and out of Erie County at different times. It depends on who the funding agency works with to distribute the funds that are available. So if you see any of those, go ahead.
I'm sorry, those would be like along the lines of weatherization and home improvement kinds of.
Yes, that would be our weatherization, our emergency repairs for, say, furnaces or roof, and those kind of funds would, they kind of go in and out without you know, double checking with them. So that once we get those databases, they should update it. They should be able to, they should keep them up as well, because we've kind of preached that with them for several years, that we can only direct the right people there if you only you got to let us know what you have and who's eligible.
Sharon, I think doesn't Salvation Army do some rent and utilities as well?
Yes, correct. That is correct. Salvation Army does do that. You're correct, John, on that. At least they have in the past, but I don't know directly who they're funded by and what the availability is. But like I said, we recognize that rent and utility assistance is going to be your most requested, and it's going to be the first thing that runs out, because it's all.
I think Catholic Charities also might have a few dollars every month
for that as well. Yeah.
For that as well, yeah.
And as far as Job and Family Services and their prevention, retention, and contingency funding, is there anything along those lines?
Job and Family Services, they have funding that kind of comes and goes, and it's really hard for me to keep up. That's why I actually refer people to Job and Family Services through 211. So we work to, you know, we hope that Job and Family Services keeps their database updated as much as possible, because I know they have different funding sources that may have different time limits and different qualifications available. But they have, yes, they've had that in the past. Do you have, Michael, have you been able to make contact with Job and Family Services to get them updated in the database?
Yes, I'm in contact with their director over there, Karen.
Karen?
And
okay, yes.
Yeah, it was a little bit of trouble getting a hold of her. I'm not exactly where I want to be with Job and Family Services, but I'm in touch with her now, and we're actually in the process of nailing down exactly what they offer. And I know that in our other counties we refer a lot to JFS, so they will 100% be in there on, you know, before October 1st.
Yep. Okay. And I know I just made contact through Angel Young is another person she's their deputy director. But when I requested the 211 support letter to get our designation changed, I did get that from Karen. So Karen knows that we're working on getting this transition going.
Okay. Yeah, I've had a couple of phone conversations with him now, so we should be good to go. Like I said, I'm behind a little bit on my own personal schedule for where I'd like to be with them. But
okay.
Do we have any other questions?
Guess not.
I guess not. Susan, are we okay to wrap up?
We are, certainly. Anything else you wanted to add, Mike?
No, I don't think so. No, both of our speakers did a very good job as usual.
Definitely.
Well, thank you.
Yeah.
Yeah, if you
These
think of
sessions
any,
get better as we go on.
if you think of anything, shoot either myself or John an email, and if it's a question best answered by the other person, we'll bounce it back to them or send it to both of us and see what kind of answer you get. See how close we are on being on the same page, right, John? So
There you
we'll
go.
get you that
That's
information.
our knowledge. Yeah.
Okay. Thanks, everyone.
All right,
Great.
thank you.
Thank you, John and Sharon.
Yep.
Okay, have a
All
good
right,
rest
take
of your
care.
evening.
Thanks, you too.
Bye-bye.
Bye, everyone.